Assalamualaikum and good morning to ladies and gentlemen. First of all, I would like to welcome you all to this forum discussion, and for your information, on this forum we will do it as a virtual forum, as you know we are now facing a pandemic of COVID-19. On this special occasion, we would like to have a discussion about ADHD. So guys, this forum discussion will tell you what everything you need to know about ADHD. But before the forum begins, I would like to introduce the panel. Our forum today is special because you will see all the women power as our panel, and all of them has a lot of knowledge regarding our topic tonight. So let's get to know them. First is Miss Nisa, second is Miss Farah, third is Miss Azyan, and the last one is Miss Fatihah. Alright, without wasting any time, I would like to welcome the presenter. On the ladies panel, today the floor is yours. For this round, I welcome Miss Nisa as our first panel to discuss everything we need to know about ADHD.
Assalamualaikum and thank you to the moderator, Miss Farah. My name is Nisa Nabilah Binti Abdul Manaf. First of all, I would like to begin the forum with the definition of Attention Deficit Hyperactive Disorder (ADHD). There are three definitions of ADHD based on my research. Firstly, Attention Deficit Hyperactive Disorder (ADHD) is called Attention Deficit Disorder. According to the Center for Disease Control and Prevention (CDC), ADHD is the most common neurodevelopmental disorder of childhood. It is usually first diagnosed in childhood and often lasts into the adulthood. They stated that children with ADHD may have trouble paying attention, controlling impulsive behavior, as they may act without thinking about what the result will be, or will be overly active. Secondly, ADHD is also defined by Dr. Timothy Lake, who is a medical advisor. ADHD is a mental health disorder that can cause above normal level of hyperactive and impulsive behavior. He is also stated that people with ADHD may also have trouble focusing their attention on a single task or sitting still for a long period of time. Both adults and children can have ADHD. It's a diagnosis the American Psychiatric Association (APA) recognizes. Lastly, as stated by Hansa Bhargava, MD, who is a senior medical director at WebMD and Medscape, ADHD is a brain disorder that affects how you pay attention, sit still, and control behavior. It happens in children and teens and can continue into adulthood. According to her, ADHD is the most commonly diagnosed mental disorder in children. Boys are more likely to have it than girls. It usually spotted during the early time school years, when children begin to have problem paying attention. Next is the data and statistic of ADHD. Here is the data and statistic about ADHD. Based on the data and statistic from Center for Disease Control and Prevention (CDC), millions of United States children have been diagnosed with ADHD. The estimated number of children ever diagnosed with ADHD, according to the National 2060 Parent Survey, is 6.1 million, which is about 94%. This statement is also supported by National Survey of Children's Health (NSCH) that 388,000 children aged 2 until 5 years, 2.4 million children aged 6 to 11 years, and 3.3 million children aged 12 until 17 years. On the other hand, boys are more likely to be diagnosed with ADHD than girls, which is about 12.9% compared to 5.6%. Now I'm going to continue with the type of ADHD. There are three types of ADHD. According to Penny Williams, an author and attitude contributor, the three types of ADHD are hyperactive and impulsive, inattentive, and combined. Firstly, hyperactive and impulsive. Hyperactive and impulsive is the least common type of ADHD. It is characterized by impulsive and hyperactive behavior without inattention and distractibility. People with this type of ADHD show primarily hyperactive and impulsive behavior. This can include fidgeting, interrupting people while they are talking, and not being able to wait for their turn. Although intention is less of a concern with this type of ADHD, people with hyperactive impulsive ADHD may still find it difficult to focus on tasks. This type of ADHD is more recognizable and more often diagnosed in children and men. Secondly, inattentive. Inattentive is characterized by intention and distractibility without hyperactivity. People with inattentive ADHD make careless mistakes because they have difficulty to sustain attention, following detailed instruction, organizing tasks and activity. They have weak working memory, easily distracted by external stimuli, and often lose things. Experts also think that many children with the inattentive type of ADHD may not receive a proper diagnosis because they do not tend to disrupt the classroom. This type of ADHD is more commonly diagnosed in adults, and girls was formerly known as ADHD. Lastly, is combined type of ADHD. Combined is the most common type of ADHD. Is characterized by hyperactive and impulsive behavior as well as inattention. People with this combined type of ADHD display both inattentive and hyperactive symptoms. People with combined type of ADHD demonstrate 6 or more symptoms of inattention and 6 or more symptoms of hyperactivity and impulsivity. These include an inability to pay attention, a tendency toward impulsiveness, and above normal levels of activity and energy. That's all from me, and thank you.
Thank you, Ms. Nisa, for the informative sharing just now. The discussion became more interesting and our viewers started to be more excited about the discussion. Now, let's proceed to the next part on ADHD. Ms. Farah, would you explain to us what are the symptoms and how can we diagnose if someone has ADHD?
Assalamualaikum and thank you to the moderator, Ms. Farhana. But before I go deeper to the questions, I would like to introduce myself. My name is Ummi Wahidah Binti Fauzi, and for today, I will explain about the symptoms and diagnosis of ADHD.
Yes, sure. I would like to explain what are the symptoms of ADHD in children and adults first. ADHD manifests differently in each individual. Hence, there is a diverse set of criteria to assist professional help in reaching a diagnosis. It is critical to be open and honest with the specialists performing the exam in order for them to achieve a most accurate judgment. For example, to be diagnosed with ADHD, you or your kids must exhibit a combination of strong ADHD characteristics, symptoms such as hyperactivities, impulsivities, or intentions. Next, the following elements will be considered by the mental health experts assessing the problem is: what is the severity of the symptoms? ADHD symptoms must have a negative influence on you or your child's life in order to be diagnosed. People who actually have ADHD have a big problem in general, such as it is easily to be distracted or likely to tense daydreams. Next is, when did the symptom first appear? Because ADHD manifests itself into the childhood, the doctor or therapist will consider how earlier the symptom appeared. Can you trace your symptom back to your childhood as an adult? How long have you and your child been bothered by the symptom? Before ADHD can be diagnosed, symptoms must have been present for at least 6 months. When and where do the symptoms manifest themselves? ADHD symptom must be present in numerous environments, including at home and school. If the symptom develop in one environment, ADHD is unlikely to be causes. Now, I will clarify the symptoms of ADHD in both children and adults. Symptoms in children are grouped into three types. Inactive. A child with ADHD is easily to be distracted or more likely tends to daydreams or often lose their things. For example, their body are there but their eyes movement will be moved around their surrounding and has problem to staying focused on their tasks or activities such as during lectures, conversations or long reading. Next is hyperactive. A child with ADHD often fidgets or bounces when sitting and has trouble to playing quietly because they usually interrupt others and they always moving such as running or climbing on things. In teens and adult, this is more often described as restlessness. Next is combined. This involves the signs of both either types. Next is a bit different from a child. Children have symptom of ADHD. The symptom of adults are not fixed at once because symptoms in ADHD may change as a person gets older. These are several symptoms that include such as often being late or forgetting things. For example, they feel it is okay to be late, and anxiety. When you have anxiety along with your ADHD, it will make your ADHD worse, such as feeling restless or having trouble concentrating and low self-esteem. For example, the feelings of not being good enough for everyone. Next is trouble at controlling their anger issue. People with ADHD are more likely to have low power to manage their emotions, and they have trouble to keeping their things in their perspective. We are moving on to the next part, which is I will be explaining on how to diagnose ADHD, but there are differences on how to diagnose ADHD in the children and adults. Firstly, let's get to know on how to diagnose ADHD in the children. The diagnosis of ADHD in the children is based on a set of stringent criteria. To be diagnosed with ADHD, your child must exhibit 6 or more signs of inattentions or hyperactivities and impulsiveness. A child must be experiencing symptoms for at least 6 months and begin displaying the symptom before the age of 12. They will experiencing the symptoms in at least 2 different settings, for example, at home and at school, because they want to rule out the ideas of behavior in simply a reaction to a certain teachers or parental control. The symptoms that significantly complicate their life on a social, intellectual or occupational level, and symptoms that are not just a result of a developmental issues or a tough stage are not better to be explained. ADHD not only can be diagnosed when we are still young, but can be diagnosed when someone is in adults too. ADHD is a condition that frequently persists into adulthood. To diagnose ADHD in adults and adolescents aged 70s and over, just 5 symptoms are required to oppose the requirement in younger children. Older age, symptoms may appear differently. The specialist will inquire about the current symptom as a part of the evaluations. However, according to the current diagnosis guidelines, an adult's ADHD diagnosis cannot be validated unless the symptoms have been present since childhood. If, let's say, they can recall whether someone's had problems as a child, or if they were not diagnosed with ADHD when they were younger, the specialists may want to look through old school records or speak with their parents, teachers, or anybody that know them and their kids.
Thank you, Miss Farah, for the great explanation. Wow, this discussion is good and intense, listening to each one of the facts and all of the information. Now, let us proceed with causes and impacts of ADHD. Miss Azyan, could you share with us what are the causes and effects of ADHD?
Assalamualaikum to Madam Zaira, all of the panels and all of my audience. Firstly, I would like to thank the moderator Ms. Farhana for giving me opportunities to speak. My name is Azyan and today I would like to share about the causes and effects of attention deficit hyperactive disorder, or known as ADHD. Based on my reading on the National Health Service website, the exact causes of ADHD are still unknown. But current research shows that there are several things that may lead to it. Today, I would like to share 3 of the main causes of ADHD. The first one is genetics. Genetics is the study of how characteristics such as hair color, eye color, any disorder or disease that are inherited from the parents to their children. In the most situations, ADHD is most likely to occur in the family that has someone who has this disorder. The way ADHD is carried, however, is probably complex and is not assumed to be related only a single genetic problem. It may cause by the second main causes, which is brain dysfunction. Research has identified the differences in the brain of people with ADHD and those without ADHD. Studies involving brain scans have shown the brain changes. There are certain areas of brain may be smaller than the normal brain. Areas of the brain that control attention are less active in the brain of the children with ADHD. Other than that, a brain disorder or brain injury also one of the causes of this disorder. Damage at the front of the brain, or called as frontal lobe, can cause the problems to control emotions and impulses. These people have an imbalanced level of neurotransmitters, which is the nerve cells in the brains that may not work properly. Lastly, irresponsible habits during pregnancy. A mother's health and habits during pregnancy also play a role in the development of ADHD. Poor nutrition during pregnancy can affect the baby's brain development. The risk of ADHD also greater in babies whose mothers were drinking alcohol and are heavy smokers. Research that the babies who are born prematurely or with low birth weight also increases the possibility of this disorder. Now let's move to the effects of ADHD. ADHD might also affect someone's life. Here, I would like to share how ADHD can affect in someone's social life, economic life, and also the quality of life. For the social life, this disorder may negatively impact to someone's education with their personality and behavior. The findings indicated that ADHD students are easily frustrated and distracted, having an inappropriate behavior, fail to meet deadlines to their assignments, and always making careless mistakes. It has been found that they are less likely to graduate from high schools or even college degree. In addition, adults with ADHD have been found to have occupational difficulties, that may affect their productivity as an employee and reputation in the workplace. Next, their social life also may be affected in terms of families and relationships. ADHD children create more demands on parents' time and attention that can lead to parental psychopathology such as depression, stress, and anxiety. Some ADHD adults might have difficulties in maintaining their relationships because of their impulsive talking and forgetfulness that can lead to misunderstandings. Secondly, for the economic effect, they might have financial problems. From the results of European Lifetime Impairment Survey that has been made in the UK, it found that they may experience financial difficulties such as wasteful spending, as well as difficulty to remember to pay bills and managing their savings. Parents are also facing with financial problems since they need to bear with their ADHD child's cost treatment. Lastly, ADHD will affect their quality of life, such as having depression and chronic stress. It will lead to depression since the children with ADHD may have trouble to get along with people in the school, while the adults will have difficulties at the work. While for the chronic stress, adults especially cannot successfully focus and filter out their excess stimuli, which can increase their level of stress. This is very dangerous because if they cannot handle their level of stress, it will cause other serious issues such as muscle tension, having a problem to breathe, and trouble controlling their blood sugar. I think that is all for my sharing. Thank you for listening.
Wow, that gave us new knowledge. Thank you, Miss Azyan, for the informative and interesting sharing. Without further ado, I would like to ask the question that many people are wondering. Is there any possible prevention that we can take to prevent this disorder? And if one of our family member is having ADHD, is there any treatment that we can consider to handle this disorder? I bet Miss Fatihah can fulfill our curiosity about this question.
Thank you to the moderator, Ms. Farah. My name is Siti Nurfatihah Binti Ismadi, and I would like to continue the forum by explaining about the prevention and the treatment of ADHD. ADHD can create problems in the life of the person who suffers the symptoms, but there are several ways to prevent the ADHD problems. According to the Smith-Hopper in her article, ADHD in Children, she stated some ways to prevent the ADHD in children. Firstly, she stated that a good prenatal care can help to prevent ADHD in children. It is because complications of pregnancy are linked to the ADHD. Pregnant women can increase the chance of their child for not having ADHD by staying healthy throughout the pregnancy. A healthy diet and regular doctor visits are important in preventing the ADHD in children. Pregnant women also need to avoid the use of alcohol, drugs, and cigarettes because it twice likely can develop ADHD to the baby. Secondly, Smith stated in the article that by giving a child a healthy and balanced diet from an early age is one of the ways to prevent ADHD in children. Parents are encouraged to cut certain foods that contain colorings, flavorings, and preservatives that they feel the foods can affect their negative behavior in children. Some experts believe that altering a child's diet may reduce hyperactive behavior. Besides that, Smith also stated that by creating a structured routine can help in preventing ADHD for children especially. Parents must post a daily schedule for children so that They can see it and know what to expect. The daily schedule must include specific times for activities such as waking up, eating meals, playing, doing homework, watching televisions, take part in after-school activities, and going to bed. Once the schedule is set, child must follow it as closely as each day. So through this, it can help to improve the child's ability to stay on their tasks. Therefore, there is found in the article written by Robert Siegel and Melinda Smith about the ways to prevent ADHD. In that article, they stated that several ways that adults can do to prevent the ADHD, like manage time and staying on schedule. The first point, they stated that adults can prevent the ADHD by manage their time and staying on schedule. Adults must manage their time properly. For instance, by become a clock watcher to help them keep track of time, limit the amount of time for each task they do, and plan to be early and set up reminders. They also can prevent these symptoms by deciding what they need to do first, which is the most important task which needed to accomplish. The second point is the writer stated that adults can stay focused and productive at work to manage the ADHD. ADHD can create various challenges at work, so that the writer suggests that adults must get organized at work by organizing their office desk. They also can stay focused at work by set aside daily time for organization and stay away from any distractions like noise distracts. Finally, the writer stated that the best way to stop and prevent ADHD in adults is managing stress and boosting moods by taking charge of lifestyle habits and create a healthy new routine. Adults must get plenty of sleep so that it can help them to reduce stress and maintain focus during the day. Simple changes to daytime habits go a long way toward ensuring solid nightly sleep. Besides that, they must avoid caffeine late in the day and exercise vigorously and regularly, but not within an hour of bedtime. Then, adults can practice mindfulness to reduce stress and provide more control over the emotions. In addition, the writers also suggest adults to exercise regularly because it can help adults to stay calm, minimize their mood swing, and fight with any symptoms of anxiety and depression. Adults also need to eat healthfully to help them prevent the ADHD. For example, making simple changes in what they need to eat, avoid sugar and junk food, include healthy protein. Next, I will explain clearly about the treatments of ADHD. There are a few treatments for ADHD problems. According to the article Attention Deficit Hyperactivity Disorder, ADHD, written by Hansa Barkova, a senior medical director at WebMD and MedSkip. She has stated that there are two ways to treat the ADHD problems, which is medication and therapies. For medication, there are two types of medication, which is stimulants medication and non-stimulants medication. The stimulants medication are the most popular medicines for the treatment of ADHD, even though they may be overused. It can control hyperactive and impulsive attitudes and enhance focus and concentration. There are three categories of stimulants medication, which are short-acting that needs to be taken a few times a day, intermediate-acting that needs to be taken less often, and long-acting that needs to be taken once a day. For example, Ritalin, which works by increasing activity in the brain that controls attention and behavior. It can be offered to adults, teenagers, and children above 5 years old. Ritalin is one of the intermediate acting stimulants that can be taken in a small doses for 2 to 3 times a day. They also have common side effects such as headache, mood swing, and more. While the non-stimulants medication do not work for everyone with ADHD. People older than 6 years old may take non-stimulants medication. Non-stimulants ADHD medication are considered second-line or third-line treatments because the level of benefits and response are significantly lower. For example, Nazurah that can increase the amount of noradrenaline. These chemicals will pass the message between brain cells and it can aid concentration and help to control impulses. It comes in a capsule that may be offered to adults, teenagers, and children above 5 years old. It is usually taken as a tablet on Siti in the morning or evening. The patients need a regular checkup to ensure the treatment is working effectively and check for any side effect or problems. Furthermore, Hansa Bargava also stated the second ways to treat ADHD, which is through therapies. These treatments are focused on changing behavior, which is psychotherapy, behavior therapy, social skills training, and special education. The psychotherapy treatment is a counseling that will discuss about ADHD. The parents and their child with ADHD will learn how to control their emotions and frustration. It will help to improve their self-esteem and cope with their ADHD life condition. Then, the behavior therapy treatments is involve behavior management that teach how to replace bad behavior with good ones. Parents need to make a clear and simple rule to let the child know what behavior that they expect. They can use a reward system to encourage a child. When child lose control, help them face consequences that parents have set up like times out and losing privilege. Parents need to praise and reward them because of their good behavior even for a small amount of progress. Moreover, the next treatment can be used is the social skill training. It can teach the child how to behave in social situations such as taking turns and sharing. Parents can let the child to take part in role-play situation and achieve the objective of social skill training, which is to let them know how their behavior will affect others. Last but not least, the special education. Special education such as parent training and education programs that will help the parents to know how to communicate with their ADHD child. They need to spend more time playing and working with their child to improve their attention behavior. Special education like this will not make the parents seem like they do not know how to teach their child, but this will make them more confident with their ability to help their child to cope with ADHD.
Thank you, Ms. Fatihah, for the informative explanations. Finally, all our panels have explained everything about ADHD. Now, we already know that ADHD can have a bad impact on our lives and those around us. But we can prevent and treat this disease as well. So we have come to the end of our forum for today, and we have shared a lot of knowledge which we didn't even know before. For the last word from me, I would like to thank all ladies and gentlemen and also our panels for today's forum. A billion thanks I would like to dedicate to everyone for cheering up this forum today. Thank you for your attention and Assalamualaikum warahmatullahi wabarakatuh.